Right, so Comprehensive Disease Management course is a 4-module course series that integrates pharmacology and some of the previous courses like anatomy, physiology that you've already had, and it covers pathophysiology of the diseases as well as the treatment of the diseases, both self-care options and prescription medications. It also has some elements of assessment, and it is combined with a seminar, a co-requisite seminar, as well as several semesters of skills lab. So the course will cover pretty much all of the disease states. Typically they are grouped by body, organ, or system. So when you start with some foundations, how to read medical charts, how to write SOAP notes, how to communicate, and then you will start learning about disease states like diabetes, hypertension, hyperlipidemia, cardiovascular disorders, endocrinology, infectious diseases, psychiatry, oncology, etc. So you will cover pretty much the most common diseases that you will encounter as pharmacists or pharmacy students on rotations. So definitely pharmacology and anatomy, physiology are essential components. I think you also build on some immunology concepts. We also connect the course to the research methodology course because you do have some assignments where you end up having to read and interpret literature. I think, again, we try as often as possible to make connections with other courses in the curriculum. So I know there are some intersections between comprehensive disease management and pharmacoeconomics, drug information, but really you need to complete the entire course sequence to prepare you for rotations, so for your advanced pharmacy practice experiences. They would be missing a PharmD degree because this is a required course in the curriculum, and one of the other important things to probably emphasize is that each module is a prerequisite for the next one. So you must pass CDM1 to proceed to CDM2, to proceed to CDM3, etc. These are not courses that you can take out of sequence. So I think in terms of modern pharmacy practice, it's essential for it because whether you are working as a pharmacist in a retail setting and filling prescriptions and assessing patients to see if they're candidates for self-care or referring them, you'll certainly learn a lot of skills as well as knowledge, and you learn about how we use all of the drugs that you potentially learned in pharmacology course in terms of rationally sequencing them, in terms of creating drug regimens and plans for patients as they get diagnosed with the diseases and as the disease progresses.